Pulse is 80 beats per minute. It is of normal rhythm, volume and character. The blood pressure is 110/70 millimeter of mercury. The JVP is not raised. There is no peripheral edema, cyanosis and clapping. On examination of the pericardium, there is no scar, bulging or deformity. The apex beat is undisplaced. There are no heaves and thrills palpable. On auscultation, the first heard sound is normal and second heard sound is fixed and widely split, and the second heard sound is fixed and widely split. There is an ejection click with an ejection systolic murmur at the left upper sternal edge or pulmonary area. The lung fields are clear to auscultation. There are no signs of the pulmonary hypertension. There is no stigmata of the infective endocarditis. My diagnosis is atrial septal defect with left to right shunt. Due to the absence of the signs of the pulmonary hypertension and a systolic thrill at the pulmonary area and mid-diastolic murmur at the tricuspid area suggests that the shunt is hemodynamically insignificant. Pulse in this middle-aged female patient is 80 beats per minute. It is irregular of normal volume and character. The blood pressure is 110/70 millimeter of mercury. The JVP is not raised. There is no peripheral edema, cyanosis and clapping. On examination of the pericardium, there is no scar, bulging or deformity. The apex beat is undisplaced. There is a left para-sternal heave and a systolic thrill palpable at the left upper sternal edge or pulmonary area. On auscultation, the first heard sound is normal and second heard sound is fixed and widely split. There is an ejection click and ejection systolic murmur at the left upper sternal edge or pulmonary area and a mid-diastolic murmur at the tricuspid area. The lung fields are clear to auscultation. There is no stigmata of the infective endocarditis. The diagnosis is atrial septal defect with left to right shunt due to the presence of the left para-sternal heave, systolic thrill at the pulmonary area and a mid-diastolic murmur at the